And I want to welcome back Sheryl Gross-Glaser. You know, we talked about some kind of heavy stuff with, I don't think there's any Office of Inspector General rulings in this presentation. This is much more just to talk about some of the different things that are innovative in mobility management and different things that Sheryl and CTAA are seeing that are helping people and coming up with solutions around the country, as well as what their organizations do a little bit. And then again, time for questions, more time for questions this time, I think. So please welcome Sheryl Gross-Glaser.
I was intimidated to come to Iowa, and today's presentations only make me feel more intimidated because you guys are doing so much here to share with others that I feel like I'm getting more out of this in some ways than maybe you are. So I'm going to talk a little bit about where I work. Are all of you familiar with the Community Transportation Association of America? Well, I'll ask it another way. Is anybody unfamiliar? Okay, so quite a few of you. Okay, good, good. So we're a membership organization, and our members are transit systems, transportation providers, state DOTs, human services agencies, planning agencies, other providers, people who are committed to transportation for people of all ages, all ability levels, all destinations. We are always available. If you contact anyone at CTAA, you will get an answer or your lead to an answer. We are really committed to working with people across the country to expand, to improve transportation wherever you are, and I mean that not only geographically, but in terms of whatever kind of transportation you're currently providing, and making sure that the needs in your communities are met. We have an annual expo conference, usually at the end of May or beginning of June. This year we're going to be in Pittsburgh. I know there's a few of you who come to our conferences, and that's our main event, but we do sometimes get out, and we usually have people at the state public transit conferences as well. So I work on two technical assistance centers. I'll talk about NCMM first. As you can see, NCMM is a partnership of 3 organizations: Easter Seals, APTA, American Public Transit Association, and us, Community Transportation Association. There's no lead partner. We all work on different aspects of the NCMM goal, and we're funded by the Federal Transit Administration, and we work with them to determine what our tasks are going to be. So, what do we do? Oh, can you see that? I think it's a little, it looks a little off-centered to me. So I'll let you read that. I won't read it. So basically, in a nutshell, what we do is we're here to help. As I said about CTA, you can understand why we're a partner, because we're working to expand and improve transportation options. Mobility management has a person-centered perspective, often a system-level perspective, but also we work with people who act in some way like social workers in terms of working one-on-one. I forgot to put the end parentheses in there, I apologize. So 2 aspects that I think we work on a lot are outreach, public participation, and also on the design of transportation systems, helping with communication as well as design. We have healthcare access design thinking grants, and the information is on the website. NC, I have it on a different slide. It's like one of those things that just comes up when you do it. It's on the next slide, so I'll let that speak for itself. So anyway, the deadline for those grants is October 5th. We did a webinar on it. I'm sure the webinar is archived if you need more information about that. And where you go for information, NC4MM, or National Center for Mobility Management.org. Either way, you'll get there. We have a few different, well, we have a lot of resources on our site. It could take you hours to go through. But we have introductory modules. So if you're new to transportation, you can look at those. They're very basic, but kind of fundamental introductory concepts and rules that are looked at. We have our webinar archive. The LinkedIn group is great if you want to connect with others about transportation issues. If nobody answers you, I've got to say that I at least will look at that and say, oh, somebody's asked a question and nobody's answering, which usually means that there's other people out there who have the same question, but it doesn't, maybe there aren't people with answers. So I will always look at those and see if we can get you an answer or somebody to speak with. And those are our different avenues that we release information out. We're very active on Twitter. We have a monthly newsletter. I share a lot on the LinkedIn group. Here, why don't we stay there for a minute? The other technical assistance center that I also work with is Transit Planning for All, which is through the Department of Health and Human Services, and it concentrates on inclusive planning for people with disabilities and older adults. So that's helping communities who have applied for small grants to work on those issues, and then we exploit them by doing case studies on them and trying to learn from their experiences. So that also has its own website. You can look up Transit Planning for All, with the 4 being a digit. And then we have the ACL Toolkit, which is at acltoolkit.org. And that has all the case studies and other resources, and we post new news and inclusive planning, good examples of inclusive planning that we find. Okay, let me see. Something's out of order. No, we seem to have one slide that didn't make it up there. Okay. So I'll talk about this in a second. I had my cute Paddington Bear slide, which somehow is not up there. I apologize. So my question is, what is mobility management? Do you use the term here? Does it have a specific meaning for you? I'm just curious, can anybody volunteer, or just a few different people? It doesn't have to be a formal definition, in fact, I'd rather it not be a formal definition, but does anybody, what would you say mobility management is? Okay?
Being able to navigate the system so that you can effectively meet your objectives and needs.
Okay. Anybody else?
So the American Cancer Society, we serve a very small portion of patients for a very specific need, but when we have a patient situation that is a very difficult person to get from point A to B, and our program doesn't provide that service, and nor can I find one, I really heavily rely on our mobility managers across the state of Iowa as people who move people.
Right.
Period. And they're really good at knowing the resources I can't tap into and helping me to extend my scope of service to then help find resources that can help that person get from point A to B when my original plan and resources are not working.
Right. Anybody else? Okay, I think that those two answers really And the panel we had, the local panel and the refugee panel, really show the heart of mobility management, which is meeting communities where they are in terms of what they have to offer in transportation, making sure people get to where they need to go, and as you said, going that extra mile. Iowa has a really superb statewide network of mobility managers who learn from each other and are very together. They're very coordinated. They know what's going on throughout your state. So they're a great resource and they're very committed. So what is this doing in there? Before coming here, I read the autonomous vehicle report that came out of Iowa. It was done by the Iowa DOT, or it was released by the Iowa DOT. I'm not sure who exactly wrote it. And autonomous vehicles are definitely a personal interest of mine and also a professional interest. And I just wanted to show you this because it shows all the companies, the major companies that are investing and that are investing billions of dollars into autonomous technology, that this is something long range to consider. And I think of it as not 20 years from now, but 5 years from now, what is going to be happening. This doesn't mention all the little startups, and there are tons of them. Some of them are being bought from anywhere from 10 million or getting investments of 10 million to being purchased for $1 billion. I mean, it's just unbelievable money. And now is the time to really influence what's going on. So I'll make just a couple of side comments about the presentation this morning, which I thought was wonderful because it was very engineering based, so that's like great. That's not what I would do. That's not what I know about. So I was very happy to hear it. But there was one comment that kind of bothered me, not because it wasn't meant well at all, but because I think it really shows the disconnect generally in terms of transportation for populations that are challenged versus everybody else. And that was the idea that, well, we can retrofit vehicles, right? So we'll have these vehicles and they'll be accessible if you retrofit them. And I think that's one of the problems because retrofitting is expensive. I mean, that's the system we have now where if somebody has a disability and they're able to drive with retrofitting and they have the money or source of money, then they can have a vehicle like everybody else, but it's not equitable if they have to spend all this extra money, A, and B, there are some people who, for whatever reason, are unable to drive or even not allowed to drive. Someone with a substance abuse problem who may have had their license suspended and may have an addiction or maybe on regular medication where they just can't drive. Or like my mom had arthritis. Some days she could drive, some days she couldn't drive. Or somebody who, for whatever reason, the physical or cognitive abilities aren't there, and even if they have a retrofitted vehicle, they are not going to physically be able to drive. I think we have to rethink the design of the vehicle in two ways. One is the interface with the vehicle. Is the vehicle able to communicate with us whatever our physical and cognitive abilities? Regina from the last panel just said bus number 6. Bus number 6 was great because you see the 6. 6 is a mathematical symbol, and so it's a universal symbol. And we have to start thinking universally, whether it's in terms of those interfaces or in terms of accessibility. If you have a space on a vehicle for a wheelchair, you have a space on a vehicle for luggage. You have a space on a vehicle for a stroller. We somehow think that, well, that stroller, we have to take that child out and put them into a car seat, right? You have to shift them. I wonder how many people have back ailments based on that. Why don't we, while we're going through this revolution in transportation, re-engineer our vehicles so they're friendlier for everybody. Just like curb cuts are a great thing for everyone, whether you're in a wheelchair or not, I think we can rethink the vehicle. So that's just my little PR tangent there. We've had a lot of talk today about rides on demand. I think you have to pretty much live in a cave these days not to have heard of Uber and Lyft. The terms that are used are, transportation network companies. Ride hailing was used for a while. Now ride sourcing is coming in. I think of it as old-fashioned car service sometimes. That's what I grew up with, where you could call a company. I mean, there used to be like 20, 30 in the Yellow Pages just in Brooklyn. And you'd call up and 5 or 10 minutes a vehicle would be there. So now people are doing that with their apps. Now the brilliant part that Uber and Lyft have brought to us, and when I say brilliant, I don't necessarily mean that's an improvement, but their business model is they own no vehicles, right? And all they're doing is matchmaking. It's unbelievable, right? They have no employees and no vehicles, and yet it works. We have homegrown ride sourcing. So what I mean by that is locally based services. There's at least one in Austin, Texas. There was one in upstate New York, and whether they'll survive now that those areas have Uber, Lyft, and others coming in is a big question. And I think another brilliant thing that these companies have done, they have somehow convinced venture capitalists to invest in them at a huge loss. And for years at a huge loss, right? People say, why can't you make more money in public transportation? And not many people are saying that to Uber and Lyft. But the genie is out of the bottle. No matter where you live in this country, you think, okay, we can have that, right? The technology is there to have on-demand transportation to within a few minutes or within 20 minutes. A vehicle is there. They're now, I wouldn't say shifting, but expanding in terms of pooled rides. So you can get, I don't know if you can get it here in Iowa yet, but there's Uber Pool and Lyft Line, which is their more shared ride or carpool kind of service where you might stop at another destination on the way. Somebody will get in or get off, and you're just getting in that car. You don't know that person. They haven't gotten, like a taxi license or anything, but they're going. And they beat taxis at their own game. Taxis were hidebound by regulation. They weren't providing really great service, not from a customer point of view. They were often bound jurisdictionally, as public transportation is, and Uber and Lyft have gone beyond that. If I 5 years ago tried to get in a taxi in DC to go where I live, a block and a half from the district line, I practically had to get in the taxi and force the driver to go there, because since they're past the district line, they couldn't pick up in Maryland, and because they couldn't pick up in Maryland, it was not a profitable ride for them, right? So Uber and Lyft had just said, okay, you take your ride to X destination and you get back on and you can get another ride somewhere in the area, and they end up going all over the place. Now, other app-based on-demand arrangements are coming in, and it's the same kind of theory, right? That you can have on-demand, spontaneous arrangements. And I'll mention something that I didn't even think about when I put this together. I don't know if any of you had heard of this. I just heard of it very recently, which is spontaneous long-distance transportation. So there's something called Skedaddle. That's just one of the apps. There's like 5 or 6 now out there. And you can get the app, and let's say you're in Iowa, and I'll say something I hope is not completely offensive to you as Iowans, but I'll take the risk. So you're going from Cedar Rapids, and you're a Penn State graduate, and you're a big Penn State football fan. Okay, don't pelt me with tomatoes. And you figure, okay, there's at least a few other people who might be going to that Penn State game. So you can get on Skedaddle, and either you know your group and you all get on and request that shared ride, or you put that out there. You say, I'm forming this ride. And if you get 10 or more people, I think it's a pretty reasonable price. They'll supply the driver and the bus. Now, it might not be a bus, it might be a van, but whatever. They'll supply the vehicles. So it's not even like you have to volunteer someone. And it started with things like that, going to festivals, going to games. It doesn't mean you'll necessarily get those 10 people, but I think of it in my very New York mind. I can't help it when, you can take the girl out of Brooklyn, but you definitely can't take Brooklyn out of the girl. And so I think of, when I go to New York. So we have, usually we'll just take whatever to Manhattan, or we'll drive, which I hate that drive, but anyway. But something like Skedaddle. So I have the friend on Long Island, and it's an extra hour and a half to get out to the island. So I thought, this is great. What if I could get a Skedaddle ride? I still don't have to drive. I can get it both ways. Maybe it's not door to door, but it's not all that far, and I don't have to spend that extra hour. I'm saving a lot of time. I don't have to think about, oh, okay, do I take the Long Island Railroad, or what do I do, any of that stuff. And I think, you may say, well, what does this have to do with mobility management? But I think it has everything to do with mobility management, because this technology is becoming more and more available. You have major universities in the area that I'm sure have computer science majors who can be tapped to develop these kind of things. And because this is where the expectations are. If we're going to be person-centered, then we have to say, what are the expectations of people? And the expectations of people is that transportation is going to be more and more convenient. So Iowa is already doing this. And there was an article in this July in Quad City Times, so I believe that's this area, right? So Translock, which is one of these, it calls itself more of a MicroTransit company, worked on a vehicle location system, so that's real-time tracking of buses, notification of route changes. Translock will also help with MicroTransit, and I'll explain what that is in a moment. So Davenport City Council is using a federal grant to pay for coordination analysis to study how systems can collaborate and look at possible solutions, and these are the first solutions. And then further down the road, they're hoping to do coordination of dispatching and maintenance of vehicles. So I talk about Translock only because I think they're a good example of a company that's not well known and that's sort of a more behind the scenes kind of operation. They actually have free transit route scheduling software. It's sort of like their loss leader, I think. And then they do this MicroTransit. So what is MicroTransit compared to ride sourcing, compared to public transit? So public transit, you have your fixed route schedule, right? Well, you're supposed to know when the bus is coming, where it's coming. And MicroTransit, if you've ever heard of Bridge or Chariot or Via, Bridge is out of business now, but Chariot was bought by GM. I believe GM. I hope I'm not getting that wrong. It's either Ford or GM. Anyway, so what did they do that's different? What they do that's different from an Uber is they're not sending out a car. They're sending out a small bus, usually a very nice little bus. You can call it by app. It's sort of spontaneous transit. So with 19th century technology, there was no way to say to someone, you want your vehicle at 8 a.m. Today I'm leaving at 8 a.m. for work. Tomorrow I'm leaving at 8:45 because I'm going to a meeting. It's starting late, so I don't have to be there. But the next day I'm going back to 8 a.m., but I'm running late, so I'd really like the vehicle about 8:10. There was no way to account for that, right? Unless you took one of a few transit systems in the US where you have service every 2 to 10 minutes, and you could be that spontaneous, it really created a problem. Even with most commuter rail, you can't be that spontaneous in the US. So MicroTransit, the idea is it sort of crowdsources those requests. You know, you're brushing your teeth, you say, all right, this is about when I'm going to leave, get on the app, request the vehicle, and it doesn't come door to door. It's coming, you know, somewhere in the area a few blocks away, and then you're going to be let off probably a few blocks away. So what does that assume? That assumes that you have walkability. That assumes that you don't have a disability where you need to be taken door to door, but if you have, either if you can walk or you have a disability where you can go those few blocks, you can do it, and so it becomes, like transit, a cheaper way to transport a group of people, but do it on demand. Now, a lot of these things are starting in major cities. When I say major cities, I mean much more densely populated cities that already have a transit-rich environment. And they're doing that for a few reasons. One, because they know there's a lot of people who don't have cars or who don't want to drive, or maybe who have one car per household, right? So they know there's a lot of people looking for some kind of ride, whether that's on a bus or on one of their vehicles or on an Uber or on a taxi, or who maybe sometimes bike but don't always bike. So they figure that there's a lot of people. They also know that it doesn't matter what area you're in, even if there's a lot of transit, there are routes where a lot of people are going that aren't that transit friendly. So that's where they sort of cherry picked, right? So they're going for those corridors. I won't give any examples, only in terms of, I don't want to use a New York example or a DC example, and you're going to be, well, I don't know those neighborhoods. But trust me, even with Metro in DC or the subway in New York, there are areas that aren't as well served by transit. So it's all relative, right? I might think of a transit desert as, a half mile from a bus and a mile and a half from a subway. You have a different vantage point in Iowa, but either way, it's that person who perceives themselves not to be well served by transit, or because the pedestrian environment isn't such that they can get to transit, that creates your perception. So these companies have started out in San Francisco, in New York, etc., DC, Chicago. They haven't started out in a place like Cedar Rapids. And I'm going to get to another slide first. Okay. And I want to go to this slide because I have some failures here, and I think the failures are as instructive as the successes. So why haven't they come to a place like Cedar Rapids first? My mind, the way I process the information from this MicroTransit or even from the ride sourcing companies is I say, wow, why are you going to New York where anybody who wants a ride can already get a ride, right? why aren't you coming to Cedar Rapids where you don't have as complete a transit system? And there's a good reason, because there's been these failures that really show us, well, they illustrate what I've already thought, which, you know, confirmation bias. Which is that in places where almost everybody has a car, where the road network is geared around cars, where there's free parking almost every place, where the high cost of free parking is not paid by the person who's driving and parking, that those places are a hard sell for these services. There was a pilot program done in Centennial, Colorado recently, and I think the Lone Tree, Colorado is trying to make up for that, where it was an exurb, so someplace very suburban, very spread out, and they had cheap service. It was with Lyft for 3 months. So you could use the Lyft to or from the light rail, and it was subsidized, and it was a failure. So why was it a failure? One, they did very little in terms of marketing, advertising, and two, people are already, if you're living in a place like that, right, likely that you're using your car for pretty much everything except for that light rail trip, that any trip you're taking within the community, including to and from getting light rail, is in your car. And that makes a chicken and egg kind of situation, right? If you already have the car, you're using it, are you going to use these first mile, last mile services? We'll see if the Lone Tree experiment works out, because that's free service, and I'm a big believer in fare free because there's no barrier. There's no, do I need a card versus an app versus $1 and change, right? Once it's free, people think of it as very easy. That's why I have the Mountain Lion, not Mountain Lynn, zero fare system in Missoula, Montana, because they did this nice experiment, it worked, and now they have a 3-year extension for fare free. And there's some other fare free systems around the country. But don't think that fare free is itself the solution. Because as one of my speakers once said, when I had a fare free panel, he said, lousy service is lousy service, and if it's lousy, even if it's free, people don't want to use it. It takes one barrier away, but you have to have service that people think of as going where they want to go, when they want to go, as convenient, as attractive. So the Salem, Oregon, and Kansas City MicroTransit experiments also didn't work. Bridge was the company. They worked with Ford. Ford contributed their vehicles in Kansas City, and that was supposed to, give a sort of another option, right, outside of transit in Kansas City. Kansas City is pretty spread out. There is transit, but if you've ever been there, it's not easy to figure out, certainly on the street. Maybe with the exception of the Max bus, they have this nice BRT system. And I know they have other stuff since I've been there, which is like 3-4 years. But anyway, they have a lot of free parking. And if you talk to people in Kansas City, which I have done, because actually my husband used to work, he had a project there for many years, so he used to go out there, and I sometimes would go with him. And you talk to people there, and unless they're using the bus system, which is a pretty good system, people just are not aware of where the buses go and when they go, and so they're not using it. And then you throw in this experiment, and unless you're doing really good outreach that speaks to people, you're supposed to be getting those, right? It was for choice, so-called choice riders. They're not going to know about it, and they're not giving up the car that they're already using every day, that's already convenient because the parking is free. So I think a lot more has to be done on that, and we'll see as we get to more automated vehicles, as these modes merge, if that will make a difference. Now for you in Iowa, congestion is not really your problem, and that's what's behind a lot of new services. It's what's behind a lot of mobility management that goes beyond helping specific populations. And because you don't have that issue, and people aren't clamoring probably for lots of transit, it's a different issue. So what is your cost of having an auto-based culture? And I'll list a few of what I think maybe those costs. You have the building and maintenance of parking, and somebody's paying for it. People are just not paying for it directly per use. You have health problems from people not being active enough. You then have unused spaces that can be used either as public spaces or for development. It's a deterrent to healthy transportation choices like biking and walking. And although you don't have congestion, which causes delay, you probably have some time inefficiencies in terms of the transit that you do have, right? Because you're either waiting for the bus or you can't get it all the time. So those are your costs. And the cost of congestion, the cost of expensive parking is that people are more supportive of these other choices. And the question for you guys is there support for other choices in Iowa? Now, Liberty Mobility Now is a nice example. I mentioned them this morning, and this is their first project that's off the ground. It's in Ohio, but they are really spreading like wildfire. They are very ambitious, and they are app-based. They do have a call center like in Ohio. The company was started by somebody out of rural Nebraska who seems to really understand rural transportation. But it's still mostly a technology company, but their approach is to have somebody at the company locally who is a mobility manager or a similar title to get the project going. And there's buy-in that has to be done regionally or by the community, but it's supposed to be helping with rides for people who don't have rides. So rides to medical appointments, rides for people with disabilities, all those things. And they can rely on volunteers, they can rely on professional drivers. The question of whether it will work, whether this company or a similar kind of services will spread, I think is still an unknown, because it's still kind of in the early stages, and we don't know. Okay, so I'm going to go back. So what are innovations that we see in smaller cities now that can also be instructive? And I thought these were all very interesting examples. So we have GoLux, which is operating in Grand Rapids, Michigan. And their idea is, let's not just make this for the needed rides and for the desperate people. Let's have this be something that's really enjoyable to use, that's an attractive option for people. So they do trips for evenings out, events at church. They don't call their drivers, they call them chauffeurs. It's all accessible vehicles for people with disabilities and older adults, and whoever is going out with them. And you can use a phone call for a ride. Or it can be app-based, but you can use a phone call for a ride. So they're trying to make transportation something attractive, not something like, here, we'll get something together for you if you don't have a car. rapid transit. I believe they're now in 10 counties in central Pennsylvania. And they have, like some of the larger transit systems, they now have a paratransit partnership with Uber and Lyft. So what they do that's interesting and that's different is that the customer is going to get the ride, right? You request the ride, but you may be getting a ride in a different kind of vehicle depending on when you're requesting the ride and depending on what demand is at that time of day and in that place. So it's a little bit more flexible even. The Florida City example is subsidized, so the Uber rides are 20% off. If you've ever taken Uber, it's already subsidized. I mean, by their venture capitalists, but if this is publicly subsidized 20%. I wonder about this experiment only because even though it's in 5 Florida cities that are close by, you have to be traveling within the city limits. And so, again, it's that jurisdictional limitation, which obviously we don't have in our cars. And I don't, okay. Oh, where's the, I'm not sure what happened when I sent this to you, because I changed a few slides a teeny bit, but I didn't add any or detract any. And there's a couple that aren't showing up. Okay, that's okay. So you have it and people can access it. And we can make sure that it's all there. So there was a report done recently, TCRP Report 191, called Public Transportation Guidebook for Small and Medium-Sized Public-Private Partnerships, P3s. That's a mouthful. Anyway, not too many people are going to like to look through a 100-page report, but I actually mined those for good examples, and I found a couple. One was one of those Florida cities. So again, I'm questionable. I think it's a great experiment, so we'll see how it works out. And the other one is Paris, Texas. The local hospital, Paris Regional Medical Center, is the sponsor of a new fixed route, which they call Paris Metro. And it provides 12-hour service along 4 routes of the city. One route directly goes to the medical campus, which is located outside of the city center, and it was previously inaccessible by public transportation, and that is not fare free, but that's okay. I'm not that inflexible. And I would say that the low-tech lessons from those, and I think we always need to learn those lessons, we shouldn't get too enamored by technology, is having easy information at bus stops. You know, time and time again, I know people who go to, you know, some big city or another, and they come from a place where they hardly ever use transit, and suddenly the car is parked somewhere, or they don't take it at all, and they're on, you know, the Boston T, the DC Metro, New York City subway, right? But they're not on local buses, right? Why do I, even in DC, go outside of my comfort zone very, very seldom, and then usually only using a few buses, right? Because bus information at a bus stop is generally an unfriendly affair. And when you compare it to subway information, I don't care where you're going, as long as it's in an alphabet that you can figure out. So the United States, Canada, Western Europe, right, until you start going to Asia and you realize the Roman civilization, the Roman Empire, did us a great service by giving us, you know, one alphabet across such a large area. That you can go to other countries and you can easily use their subway system, but you're almost never using a bus, even when you're going, you know, some city that you've been to many, many times. And why is that? That's because the subway information is put out there in a very easy way. It's coming pretty often. There's usually now, most subway systems have real-time information. The route information is very clear. It's well lit. Usually there's a place to sit. If you're lucky, there's a good escalator, a good elevator, so it's very accessible. What do you have with buses? A small minority, right? You have real-time information. Even where I am, where I know the bus number, I know where it goes, where to get on and get off, I still find the bus information confusing. But if I'm going to someplace in Virginia, and I almost never cross the Potomac except to go to the airport, it's very easy. I'm going out to Falls Church or Ballston or wherever on the orange or blue line, or and I couldn't tell you which line today just off the top of my head because I'm a red line person. But I know that all I have to do is get to the metro, and it's very clear which line I'm going to and how to get there, which it is not on a bus. My bus stop, and I think most bus stops, don't have connecting information on them. They don't have clear route information. A lot of times you'll see like a little chart, schedule, right, of when the bus comes, and the print is really, really small, and it's like across 4 different categories, like the time and maybe a few major locations. And it's really hard to read. And I don't have, a disability. I just take off my glasses, right? My disability is long distance, not that short distance. But for anybody who's sitting below, or who's a small child, or who doesn't have great eyesight, it is really hard to read that stuff. So there's a big barrier just in terms of information to using a system that's already there. Okay, that is my contact information. I'd love to talk to you about some other stuff that I noticed from this morning. As I said, you have great mobility management in Iowa already, and your local panel really exhibited that. Express bus service, transportation for people going to work at what we could consider after hours, not after hours for them, but after hours for I guess office workers. Paratransit, a willingness to experiment, a willingness to put yourselves out there. But I'm interested in hearing from you what's going on, and I'm interested in hearing what your concerns are, and can I call you out? Okay, and I'm gonna call this young woman out because she told me about an experience she had in South Korea living in a rural area, and she didn't need a car. And I think that is actually a better example probably for Iowa than saying, oh, well, Chariot MicroTransit operates in San Francisco, like big whoop. So if you could share some of your experience.
Okay, so I'm a pretty well-traveled person, and I've definitely experienced in being in various countries, various continents, various cities within the U.S., various types of transportation. I've taken note of how some maps are more user-friendly than others, different cities. South Korea is very well developed on smartphones. They live on those things, and they've got apps. You can take track of the buses and know where they're at. Same with the subways. They'll tell you which door to get in at for the fastest transfer if you need to transfer lines. And my experience, I spent 2 years living in rural South Korea, and so the city or town by South Korean standards that I was in was the size of Cedar Rapids population-wise, but it was in a much more compact area. And so we didn't really have local buses within the city because 20 minutes, it would take 40 minutes to walk from one side to the other, and if you're already in the city center, just 20 minutes to get to any extremity of that city. You could go to small towns like Shueville or Healy or something using local transportation, and those ran every hour, hour and a half or so, and so elderly people who were low-income farmers and very physically challenged were still able to get around and go into the larger city to get market produce and take it back home. And so they had multiple routes throughout the day. These ran on similar schedules to what Cedar Rapids currently has, about 6 a.m. to 6 p.m. Some routes did run as late as 8 p.m. But I noticed that even out there, I was able to get anywhere that I need to, not always super conveniently, but it was possible, and that's imperative to, especially anybody with disabilities, or just lack of funds to be able to pay for the upkeep of a car. And these were very well used, not just by low-income people, but also middle class. Children and students would use these to go from these rural communities into their schools. They'd stay in the city late at night studying, and then go back to their hometowns. And so it provides everybody of all ages and various income levels greater mobility. And that helps to subsidize when you've got not just low-income people using subsidized transportation, but increasing demand and use by people who are paying the full fare so that you can have extra money in the cash box and be able to then provide updates and expand usage schedules to areas that people want to access more.
And I'm going to ask you one more question. Where do you think that public support came for that kind of transportation system in a smaller community?
Ultimately, what I've seen is that government plays a huge role. Sometimes having an initiative from the top will be very effective in changing people's minds. And so an initial injection for politicians to say, we are going to take this to heart, and we are going to put money towards this, and we are going to have ad campaigns out there to help influence the public and change their minds and get them to use these, inform them about them, help them realize how much it's going to impact the easiness of their lives. Rather than spending 30 minutes in traffic, you could be reading a book or answering emails on your morning commute. And so middle class workers and business professionals and staff they learn to love it.
Right, right.
Then it becomes a concern of theirs to go to their politicians and say, well, we like transit, but it's falling apart, so let's get more funding into that. And then you've got a larger majority of the population that is caring about concerns that right now are really affecting a small pool of people
Right.
who really need those advocates to make sure that they have proper transportation access.
Right, right.
I mean, don't you think a lot of those sort of questions, that to some extent that ship has sailed? We're not a country that's that small. We're a country that's that big. And we're spread out all over the place. And we've developed this consumerism culture that you have to have a car. You have to have a bigger house. You have, we've sort of gone down that road, to use a transportation metaphor. And I don't know how soon we're going to be going back. It's, and the government just sort of figures, well, yeah, you're on your own. We don't have to do that for you. You can go buy a car. You can go take care of yourself.
I'll disagree with you. And I'll use the Affordable Care Act as the comparison. I mean, whether you agree or disagree with what it provides for and how it's been implemented, it's been here for a number of years already, and we see that many senators in particular have been unwilling to vote for repeal because their constituents are already depending on what that act provides for. I think we also see with that analogy a really wonderful example, again, whether you agree or disagree with what the act provides for, of activism by people with disabilities. And I don't know how much you guys have seen of it. People in wheelchairs, others with disabilities showing up at the Senate and very in your face shouting about their concerns. Basically to gain attention, right? For the TV cameras to show people this is what is at stake. You know, our lives and our, not only our quality of life, but we feel our very lives are at stake with repeal of some of these provisions. And they've been able to make enough of an impact to change the minds of some of our legislators. So I think that's one thing. I think that after the recession, we've seen less of a pro-sprawl, a pro-huge house attitude that I find is a good thing, personally. But I think we also have a generation that, as you said, they are tied to their phones. One of my kids got mad at me once because I texted at like 7 in the morning. Just, you know, something came to mind and I didn't want to forget it. And she's like, "Why are you texting me this early?" And this was, you know, a minute later. I'm like, "Why are you answering me at this early in the morning?" Because the phone is right there by her pillow. I mean, it is, you know, it is their alarm clock, it's their phone, it's their camera, it's their timer, it's their music source, it's their web source. I think for those of us who grew up in the age before smartphones, we don't necessarily depend on it in quite the same way, or we're a little bit more skeptical of depending on our phones in that way. But they really consider it as the source for everything. And if something isn't being supplied on the phone, I think they assume it soon will be. So their whole mindset is that I want to have access to that phone, I want to have access to information and to communication at all times. And for them, the idea is if you're driving, that's time you're not in communication. And I think that can be a game changer. For whatever reason, you know, we had TV shows that started about 20 years ago that started being less enamored of suburbia and more like middle of the city is cool. We have a generation now that has used their feet to leave rural areas to go to either smaller cities, larger regional cities, or very big cities. And we've seen some depopulation. So that shows that that space and that that willingness to drive everywhere is not as universal necessarily as we think, even for kids who have grown up in places where they have taken the car everywhere. So I don't think we should assume that our past, that our last 50 years are our next 50 years. We've seen that revolution with the phone, and I think we will, we're seeing it with new transportation modes wherever they're available, and I think we're going to see it very quickly once autonomous vehicles come into use, whether they are those pre-programmed shuttles that have limited, you know, range, or fully automated, go anywhere, tiny houses that you can take on vacation.
Any other questions for Sheryl? Next, you're going to be telling me we're going to fly in cars that will be the Jetsons.
You know, we see that already. I mean, I see testing of those. There are companies that are testing them, and I don't know how soon those are coming, right?
You know, I greatly appreciate all that you shared. I'm sorry for whatever the issue was with the slides that we missed, but you know, Sheryl's contact information not only is there, but is in your folders. I encourage you to read things on the CTA website and the NCMM website. A lot of great information. And reach out whenever you need, or if you're wanting more information. She's a great resource. So please help me in thanking Sheryl for her time today.
And I thank you, and we have a